Yep.
Just name and title for the tape, please.
Carla Bailey, Acting Chief Executive, Murrumbidgee Local Health District.
All good?
Yep, all good.
Perfect. What are we talking about today?
I thought I'd just provide a brief update on the current COVID cases for Murrumbidgee Local Health District. So Murrumbidgee Local Health District recorded 1 case to 8 p.m. last night. We recorded 4 cases on Saturday and 5 cases on Friday. So a total of 10 cases since the weekend. I think I'd also just like to mention that currently our COVID patients are being cared for in home, in the community, in our care pathway. And we have 4 patients currently in hospital in Murrumbidgee Local Health District, no patients in ICU. So that's encouraging that people who do have COVID are being able to be cared for safely in our community.
Do you have the latest vaccinated numbers by any chance?
I don't have them off the top of my head, but we have got over 95% of first dose vaccination and very close to that for second dose vaccination rates.
Obviously, the word of the day is Omicron at the moment. I guess what information has the MLHD received from New South Wales Health about this new strain?
Yes, look, I think the advice at the moment is it's very early days. We're still obviously waiting to see what the new strain means, the new variant of the strain. We will take advice from New South Wales Health and we will follow the public health order advice that comes through.
Do you think it's possible that it could change the roadmap that we have at the moment?
At this stage, the indication is the roadmap's continuing as is, but yes, it could change, and we will go with the advice from the state.
Is the MLHD doing anything at the moment just to prepare for the threat of this virus?
We're speaking with our counterparts at the state level and just waiting for further advice. There is a new public health order and we will be following that.
Obviously, we're getting into the sort of the warmer months, even though it might not feel like it at the moment, but today's pretty good. Are you urging people to still get tested even if they have the slightest of symptoms?
Absolutely. We're always encouraging people to come forward and get tested. Slightest symptoms, please do attend one of our testing centres.
Are you guys pleased with testing numbers of late? Do you think they're sort of good where they should be, or are you thinking there need to be more people coming forward?
I think they're reasonably where they should be, but I do encourage people, if you are concerned at all, you should still come forward and be tested. We always want to make sure we keep on top of things and get in front of the virus, so it's still important for people to take note. Don't think it might be something else. If you're concerned, please come forward and have a test.
Is there anything the community can do, waiting for the advice on the Omicron strain, or just sort of wait and see?
I think the main thing is don't panic. I think we just continue on as we are and we will give you the advice as it comes forward. At this point in time, it's obviously being looked at with New South Wales Health, and we will let you know as soon as possible if anything further comes forward that the community need to be concerned about.
Our region is obviously still having cases as well, and from today schools don't have to close contact tracing or anything like that anymore. We have had many schools close over the past couple of weeks because of cases, so just how are we feeling about those changes coming in today?
Look, I think it's important that school kids are able to access their education at school. So I think the changes have obviously been put forward based on the advice from Chief Health Officer. But I think it's really important that we can enable our children to continue their education where it's practically able to be done.
And just a quick one from our Albury team as well. Do you have any updates on their cases and vaccination rates at all?
The Albury case numbers have significantly dropped compared to where they were as well. I don't have their current vaccination rates, but certainly the case numbers have dropped significantly compared to where they were, and they're in a much better position.
I'm just going to chat about something else now.
Yes,
Good,
so
well done with COVID.
We've received some funding for the Health and Knowledge Precinct on the weekend. How's MLHD feeling about that?
Oh, look, anything that can contribute to health in our region is a fantastic opportunity, and we welcome any funding opportunities that come forward. So I think it's an exciting opportunity, and we're looking forward to seeing the progress of that work.
What do you think the benefits of this project will be as well when it's up and running?
Oh, look, I think it's a really good opportunity to really strengthen and grow and really promote healthcare in the regional setting and education and the opportunities that can come forward with that. We've got some wonderful facilities here. You've got the brand new Wagga Health Services redevelopment, which has contributed to that, and we've got the other projects online with education. So I think it's a fantastic opportunity to really put regional healthcare out at the front and centre.
Yeah, and in the annual public meeting they held last week, and they said there is a bit of a staffing shortage around the region. Are you hoping that something like this may draw people to come and work here?
Absolutely. It's a really wonderful opportunity for people to come forward and work in our region, and I do see it as a great opportunity to encourage and promote people to move to rural and regional areas and come and work for Murrumbidgee Local Health District. We're always happy to see new people come into our region and welcome any applications for our district.
That funding is for planning for this precinct, and as you're probably aware, Wagga City Council has developed a master plan for that precinct. How will Council and the MLHD work together over the coming months on this project? And when we say planning, what sorts of things can we expect to come out of that?
Look, I think it's early days in terms of the actual planning process itself, but certainly Murrumbidgee Local Health District will be a partner with the local council and the education departments to work through what this health and knowledge precinct can look like and the benefits for our community.
And what sort of benefits do you see?
I think in terms of training and education, so encouraging and bringing people an opportunity to be trained locally, educated locally and stay locally in jobs in Murrumbidgee Local Health District or the region.
Are there any particular facilities or services that you think are lacking that should be included in the plan to come?
I don't want to probably preempt what the plan will look like. I think it's really important to get the viewpoints across the multiple partners and the consultation process. So I think we'll wait for that to see what opportunities come out of the plan.
There was also $25 million announced at the weekend for the Finley Hospital. Tell us a little bit about that project.
Yeah, so the Finley Hospital is in our western region of the local health district. It's a fantastic initiative for some infrastructure changes at Finley. We'll look through our clinical services plan and see what the needs are, do some consultation with community to identify and prioritise what those needs are, and then determine how that funding will be spent on the hospital.
So it's a fairly significant amount. Are we talking about a full redevelopment of the hospital there or a partial redevelopment?
Look, to be fair, we need to do some planning works to start with. $25 million is a significant amount of money. A full redevelopment is also a significant infrastructure spend. So we will have to look at how best we can allocate that funding and then work out with the community what the needs are there, and then we'll determine the process from there.
And I think $1 million was almost $1 million was spent there a few years ago redeveloping the emergency department. I take it that this funding will build on that and regenerating that service?
Absolutely. So yes, you're correct. We did spend over $1 million on the Finley emergency department with a whole new section there, and including some inpatient rooms actually. So we'll look at how we can complement the funding that's been previously allocated and what we can build on from there.
Could we see an increase in beds at the Finley Hospital?
That'll be all part of the planning process. We'll look at what the needs are of the community. And when I say the community, I don't mean just Finley, I mean the broader community that supports Finley and also feeds into Finley. So we'll have a look at that as part of the planning.
And obviously you've got local health advisory committees that work in the community as well. How soon, I guess, will that consultation start with community members and staff on the ground?
Look, at this stage it won't start until early next year. Obviously we've got the Christmas period coming up, so we'll get together a relevant community committee, and the LHAC will be very much part of that. I've just been meeting with the LHAC in actual fact from Finley, so they'll be a very important partner in us working through the project plan.
How important is the need to upgrade that facility?
Any facility upgrade is important. Some of our facilities are quite old and ageing, so the hospital flows aren't always at the optimum level that we would like them to be. So this is a really good opportunity for the community and for us to develop better flows and improve services.
Is this also an indication that the service is here to stay within the community? We've obviously heard a lot of discussion in recent years about the closure of regional hospitals and medical facilities. Does this give the community assurance that their hospital is here to stay in some capacity in the years going forward?
Look, the Finley Hospital is a really important facility in that area. It's linked with other facilities around that region, and it's an important part of our healthcare delivery. So yes, the facility is absolutely staying there.
That's it for me. Yeah.
Right. We've got Superintendent Andrew Spliet. Anyone else asking any questions?
Yeah.
All right. I'm just separately if you guys don't need them.
Good, I'll try.
Superintendent Andrew Spliet, Commander of the Riverina Police District.
Great. Obviously, we're looking at ease restrictions at the moment, but how's compliance been across the board in the Riverina?
Yeah, compliance has been really good across the region. We had a high visibility policing operation over the weekend. Police attended a number of licensed premises, and there weren't any issues there in relation to people still scanning in and showing their vaccination.
Was there anything in particular that prompted that, or was it just sort of one way to kind of monitor compliance?
Yeah, it was obviously with everything opening up and the licensed premises, there's more people attending those locations. So it's very important that we're out and about and being visible, especially with leading into the Christmas season and so forth. So it was an opportunity to, one, look at our alcohol-related crime, make sure that things were running smoothly in that regard, but also an opportunity to ensure that the right things were being done in the COVID space.
Obviously, businesses are required to take reasonable steps to ensure that only vaccinated customers are entering their premises. Have you guys had any calls from businesses talking about people who've been giving them grief about that process?
Not so much grief, but we did a lot of work, obviously, in the business space in the lead up to the restrictions and what was needed to be done with the reopening. So the message out to the community and obviously business owners is if they have any issues, give us a call and we'll respond down and get that resolved.
So do you think compliance has been getting better over time? I know during lockdown and everything there was quite a few instances, but now we're not really hearing of much.
Yeah, well, I'd have to say that obviously with the case numbers quite low in the community such as Wagga, there's been some really good work done throughout the community and by each member of the community to keep those numbers down. So compliance, previously, no doubt there were some issues previously, but we seem to be running along fairly well at the moment.
As we continue to move forward with this living with COVID situation we find ourselves in, are police looking forward to perhaps doing less public health enforcement and getting back to, I guess, the core nature of your policing work?
Yeah, for sure. It's obviously our role is to support health, especially in the emergency management space and so forth. And as things open up, our role reduces. And yeah, it's important that, as I said, leading up to the festive season, that we're out and about and back to our core business. So that's pretty much what we're focusing on now.
Okay.
That is all.
Beautiful.